My name is Dr. Ryan Maloney. I'm a PhD in biochemistry, and I'm talking about the science of low-level laser therapy. It's a very unique discipline in the sense that it was first studied by Albert Einstein back in the early 1900s regarding the photoelectric effect. And it's a discipline of science that takes a unique concentration of photons, exciting electrons within our cells, re-establishing proper energy flow, thus re-establishing proper cellular function. Now, there is diverse potential with this application.
Okay, the first thing we're going to do is point the lasers.
And two promising therapeutic applications is for the treatment of sensorineural hearing disorder and tinnitus. Although these disorders are complex and the pathophysiology is unknown, low-level laser therapy has tremendous promise in re-establishing proper cellular function at the hair cells along the 8th cranial nerve, re-establishing proper hearing for those individuals suffering from sensorineural hearing loss, and reducing the effects or symptoms associated with tinnitus.
It's made a change for me, and I have quite a severe hearing loss. So they contacted me last November, saying I wanted to participate, and since I got it approved, I said sure, because being totally blind, I didn't want to lose any more hearing, and I wanted to keep get anything back I could. So I started coming in here and getting the treatments, and initially I noticed some difference in the first couple of weeks, and then it was a little slower in coming back, but we kept after it. But
Underneath here,
I had a test in, I think it was February, hearing test, and there was remarkable improvement in both ears. My right ear, which is the worst, came up considerably, and the left ear came way up. And I've noticed that I don't run my audio equipment as loud as I used to. People say I don't talk as loud as I used to. So it's to me, it's been a great thing, because I was told before I've got involved in any of this that I just have to live with it, the problem, and I really wasn't happy about that. I'm not, I'm getting old. That's what they told me. You're just getting old. You live with it. But it's made a change for me, and I can enjoy music much more than I used to. To me, it's been a great thing.
Low-level laser therapy alters the bioenergetics of an individual cell, and it does this on a safe parameter, not inducing thermal events or any adverse events.
No physical pain whatsoever, no discomfort.
There was no pain, of course, at all.
As far as any pain, there is none.
right now we're stimulating the tragus.
By manipulating the electrons within the power plant of the cell, with low-level laser therapy, it's possible to upregulate or increase the cell's production of energy, feeding biochemical reactions that allows us to observe a diverse but a beneficial clinical outcome.
The change is like clarity, and I hear words and I have to tell my brain, did I just hear that? For the first time, she can walk away and I can still hear her talking. I almost started crying when I realized that I was overwhelmed with the fact that I can actually hear you. I would definitely, my dad's hard of hearing, I would definitely recommend it to him. I have a hearing group at work that meet every month, and it's people who have hearing difficulties. This is definitely going to be something that I want to share with them and let them know that this is available to them.
And for those suffering with sensorineural hearing loss, we can see increased hearing capacity.
I've noticed that I don't run my audio equipment as loud as I used to. People say I don't talk as loud as I used to. So it's to me, it's been a great thing.
For those plagued with tinnitus symptoms, we can see those symptoms subside so that they can have an improved quality of life.
I've had some ringing in my ear, and I've noticed it's gone down.
And all of this is done through the emission of a unique concentration of photons, that is low-level laser therapy, altering the cell's energy capacity, influencing a series of chemical reactions and allowing the clinician and patient to both benefit from this clinical outcome.
I'm hearing better. This is new because she has always had to speak quite loudly for me to understand and hear clearly. After several treatments, that she did not have to speak up as loud, and I was able to decipher words a lot better. The TV, the volume goes by a number, and she knows what number she uses. She's like a 9 or a 10 or something like that, and I was using 15 and 16. I'm down to 11 and 12 because she has a certain volume that she has to use to converse with me, and now I'm hearing better. And she doesn't realize she has to cut back until I tell her, I said, you can, And she said, yeah, this is new because she has always had to speak quite loudly for me to understand and hear clearly. So it's worked out very well. I'm on the phone a lot. I'm on the phone talking to customers and retailers and all the rest of it. So you have to understand what they're saying, and I can understand what they're saying. Where before I had some real problems.
Low-level laser therapy is the emission of a tight concentration of photons. And those photons carry a unique packet of energy that targets specific receptors housed within our power plant of our cell, which is the mitochondria. The mitochondria is responsible for synthesizing or producing a high-energy molecule known as ATP. And by sending in a unique arrangement of photons, we can alter the production of ATP and in fact increase or upregulate the amount of ATP available to the cell. Now when we increase ATP, the cell has a unique abundance of energy that can drive chemical and biological reactions. Now when we position this theory to disorders such as sensorineural hearing disorder and tinnitus, we can see a mitochondrial deprived cell in the sense that we see infunctioning or improperly functioning components of hair cells, the 8th cranial nerve, and by supplying wavelengths of a red nature and green nature, we have the ability to impact the energy production and function of the 8th cranial nerve and hair cells so that we can generate a clinical beneficial outcome for those patients suffering from sensorineural hearing loss and tinnitus.
I've told people about it, and their first comment is, where can I get it? Where can I go? I want it.
I can actually understand, even without actually hearing all of the syllables and the words and the actual hearing the crispiness of the word or the sound of the word, I can actually hear what it sounds like, and therefore I can interpret what the person is saying to me without fear, and that is hugely beneficial for me.
I think the first test I took, it was like 80%, and the last test I came through were 90%, and that was after just a few treatments. I think with this new machinery and so forth, and doing further treatment, it's going to go up.
What we're seeing over my left shoulder is the device that is utilized for the treatment of sensorineural hearing loss and tinnitus. It emits a unique color combination, green, which is 535 nanometers, and red, which is 635 nanometers. Histologically, those wavelengths have been identified to promote nerve function, as we want to stimulate the 8th cranial nerve, and hair cells, as we want to treat or stimulate with 635 nanometers, altering energy production. By combining this unique array of photons, as you can see in a line-generated pattern, we are ensuring proper depth penetration so that we can effectively target the cells that are in need of this energy boost or energy increase in capacity, and we want to stimulate the 8th cranial nerve. So this unique line arrangement of photons gives us the depth penetration and the unique biological outcome so that we can resolve or help with symptoms associated with 2 major disorders of the auditory system, sensorineural hearing loss and tinnitus.
I'm expecting more. I really am, and I'm excited about what's happened so far.
It has
Is
made
it
a
making a
difference.
difference in your life then?
Oh yeah, and I'm sure it's going to be when I take more of the treatments as we go on, like we've talked. It's going to improve more.
I'd say anybody who can get involved in it should give it a try if it's, you know, if it's a condition that can be treated by it.
Now we talk, and it's like I totally can hear you, you know, and it's like, wow, thank you, Star Trek. This is working. Technology's catching up, and it's like kind of cool, you know.